hopefully. So thanks to everybody for joining today to have this discussion about the implications of the COVID-19 pandemic on sports medicine research. I'd like, before we get started, to just have each of you kind of go around and introduce yourselves. I think a lot of people probably know some of your contributions to sports medicine research website, but give you a chance to kind of introduce yourselves to the audience. Steve, do you want to get us started?
Sure. I'm Steve Thomas. I'm associate professor at Temple University, and I run our ARMS lab, our adaptation to repetitive motion and stress. So we study a lot in the shoulder of overhead athletes. And I'm also one of the co-founders with Jeff of Sports Medicine Research Site. So.
Thanks, Steve. And Nikki, would you like to introduce yourself?
Sure, I'm Nikki Cutano from Westchester University, where I'm an associate professor and the graduate program coordinator for our post-professional program. I also serve as our university's the co-chair for our Westchester University IRB. So we've been dealing with some interesting things as this has been going on.
Thanks. And Jane?
Hi, my name is Jane McDevitt. I am an assistant professor at Temple University, and I run the Sport Concussion Lab, where many of our athletes will perform their baseline and post-concussion testing, and we are looking at biomarkers and risk factors for risk of concussion as well as risk of prolonged recovery.
Great. Thanks, everyone. So I think over the past few weeks or months, we've been seeing kind of how the pandemic is starting to have its effect on research, both in good and bad ways. Good ways such as fostering new collaborations and showing how quick IRBs and clinical trial teams can get up and running and working together across the country and across the world, but also in how some of the problems we have and how information gets disseminated from the research community. What I was hoping we could talk a little bit about today was how this might be specifically affecting us within sports medicine. And I kind of wanted to open it up to you from your perspectives at your institutions and your labs, how you think the pandemic is going to be having an immediate effect on sports medicine research and how it might impact things down the road a little bit.
So yeah, I guess I could start. Yeah, I mean, for the most part, it's not really essential research right now at most universities. So everything that was going on, it really came to a halt. So especially if it's prospective data, you know, it stopped, and now you're going to have kind of a partial study at best. So depending on how many data points you had leading up to this, you know, you're going to be very limited. And if you're doing, say, like a pre-post period of time, where you're only going to have a pre and a post measurement, you're not going to have that post, so you really don't have a longitudinal study now. So I think that's going to have a big effect, and I've heard some of that already in the baseball community. So a lot of studies that MLB was running, or those involved in Major League Baseball organizations, they had a lot of that preliminary data at spring training, but now it's done. And you know, it's really not going to have the same study design, even if the season picks back up. So you know, that I think those types of studies are really going to be have a detrimental effect, and you got to look at it's probably going to be a 1-year lag, really, because to get this going again, if you're doing, you know, with sports and teams, you have to wait for the next season to kind of start all over again. So it's not just, you know, however many months this is going to last. It's really a full year lag you're going to see, I think.
And then there's always that possibility that this could kick in again with a second or third wave and cause even more problems down the road like that.
Yeah, absolutely.
What I think is also interesting is, yes, a lot of our research has come to a screeching halt, and we're trying to figure out creatively, is there anything that's clinically meaningful that we can pull from the information that we have? If and when we get back up and running, there might be implications just as far as training, and you know, whether or not folks try to just come straight back and full force from a load perspective. I think could really have an effect on some of that prospective data that you might start to collect again. because they're going from situations where they might not be nearly as active or training like they should be. And then they're going to try to kind of re-enter. And so I think we're really going to have to be cautious in a load monitoring situation when we're looking at certain outcomes.
And that's interesting from the point of view of just, that might impact if you were doing an injury prevention study or you were tracking the effect of injury prevention implementation, you could have a surge of new injuries after this potentially if people don't return in an ideal situation. And then that could create some funky data that we might not fully appreciate.
So one thing that we're doing at the Sport Concussion Lab, and actually kind of going off of what Nikki said, as well as what Steve, you brought to the our program meeting last week, is what is the stress that the athletes are feeling right now. So bringing that into the baseline testing and trying to think of can we still possibly prepare for we don't know when we're going to be going back. And like you said, Jeff, if we're going to be going back and then, having to go back into remote, just getting some baseline testing done, as we can, and trying to think about how we can best maybe start this remotely if possible. And starting to think about implementing a lot more patient-reported outcome measures that assess anxiety, stress, sleep. Some athletes might be sleeping a lot more, but there are some athletes that might be under a lot more stress because, their athletic identity is changed. Their very scheduled, day-to-day living has changed, and then obviously their practices and their physical activity levels have probably drastically changed, based off the equipment not having, a lot of equipment possibly. So one thing that we're doing, to try and get on top of it and try and really think about, how could this really affect not just the data and the research, but the athletes, and is by, thinking of ways of collecting remotely, as well as bringing in extra measures, to assess.
Yeah, I just want to add too, I think what Nikki brought up was really important with when we think about re-entering these athletes, and we're going to see this on the professional level for sure. So baseball had a proposed plan of around May, and they were going to play some games in Arizona, but these guys obviously are trying to keep up with their training at home, but you're limited. You're not at big gyms. You're not able to really throw as much of a volume as you can normally. So if they just start the season right, like a switch, and we're going to start playing games, these individuals haven't ramped up to that level yet, and really have to have somewhat, I think, of a small spring training to build up that load, like that in game, especially from a pitching perspective. If not, we're going to see a huge surge of injuries, within the first month or two. But it does propose some interesting data to look at, what are the kind of rate of injuries throughout the season compared to previous seasons, because now we have this very truncated season. We usually play 162 games. Now maybe if we play half of that, we'll be lucky. Does that equate at the end of smaller amounts of injuries, even per exposure? So I think that could give some potential evidence of, maybe kind of truncating the season permanently. I think it's a bit ridiculous, to be honest, that they play 162 games. When you look at every other sports season, no sport comes close to that. And it's just too much on these guys now, especially for how hard they throw and how hard they train year round. So yeah, I think it's going to bring to light a lot of interesting things.
Yeah, it's a lot of things for people to think about as they start returning their athletes back to play eventually. That, we have all these discussions about starting up the economy. It's also a question within the sports medicine community of how do we start up our athletes again? And I think this also raises the idea that we need to be thinking a lot about the implications of this for future evidence that could inform sports medicine. And, this isn't going to be something that we're just going to see affecting papers for the next year or two. This could potentially be in papers for the next 5-10 years. And, at the website, we're often focused on what's the key things to take out of a paper to kind of appreciate the generalizability of that specific finding to our clinical practice. So, going forward, are there certain things that the three of you are going to be looking at within a paper to kind of see, could there be some kind of weird generalizability issue here because of the pandemic?
I think, Jeff, that's a great question. I think that understanding when the data was collected is going to be important, because if we're trying to get an idea of, is it the former normal or the new normal in regards to what we were looking at. To Jane's point, there's a ton of new things that I think are being made more aware of that we can incorporate, which will ultimately long-term probably benefit the research and the patients that we're working with. But I think in interpreting the findings from a paper, I think really understanding when the data collection and the research study went on might be important, just to see, was it a fluke? Or is it possibly generalizable, for what we're currently looking at?
Yeah, and just to jump off that even further, was any of this collected via a telehealth or in an online format based off of a very controlled clinical? I'm not sure if that's going to add external validity or if we're going to be comparing apples and oranges. So that's another thing that I think we're going to be looking for in regards to especially some of this pre-post or prospective data collection.
Yeah, I agree with all that. It's going to be tricky. You just have to read with a fine-tooth comb. And I think even if you're looking at it from a reviewer standpoint, if you're reviewing some of these, as a reviewer, you have to ask these questions. And I think, it might need to be a blanket statement in publications that have collected data kind of throughout this span is, part of this data was collected during the COVID-19 pandemic, just to kind of bring readers aware and say, okay, let me look at this from that perspective. And maybe it might, introduce some really interesting findings, but just to make people aware, because, over time too, if you read this article 50 years from now, people are going to forget that, this even, not necessarily that it happened, but they're going to, forget the time frame, forget that I should even be aware of that, so I think just to keep the historicness of this event to the data, I think, this kind of blanket statement should probably be included in most kind of publications if it was collected during this time.
Yeah, that's a great point.
And do you think moving forward, having this kind of historical time, do you think that having that blanket statement, would anyone that be collecting during the COVID-19 pandemic, would their data be excluded from, things like systematic reviews later on?
Yeah, I was thinking about that, and you kind of have to wonder that if you start doing a meta-analysis, you kind of need to check to see if the studies from this period are going to start becoming outliers to the data.
Sure.
Yeah,
go ahead.
Sorry, I was just saying there's a lot of trickle effects that, many of which we probably didn't even anticipate or think of yet.
All I was going to say is that it's going to be interesting, because as publications start coming out, I would say within the next 3 to 5 year period, it's going to be very gray as far as, was it potentially data that researchers were sitting on and then had time to actually get published at this phase, or was it actually collected like during the pandemic? But what's been really neat to me, and I think just for the greater overall clinical world, is the fact that athletic trainers have been able to step up and, work via telehealth, so I think there's a lot more opportunity for research kind of in those areas, looking at alternative modes of delivery for athletic training education, sports medicine education, and whether or not that's been effective in career preparedness, so just thinking of a little bit of a positive spin amidst some of the negativity.
I definitely think that this will open up, and I think this really kind of forced us to take on telehealth in a new open arms kind of light. And I do think that we were heading there, but very, very slowly. very slowly. And I think now, especially now that we probably had our nieces, nephew, children, having to do appointments via telehealth and actually getting exposed and experiencing how telehealth could be helpful and how to work and perform telehealth. I think that'll also kind of continue to open up the doors and drive athletic training further into utilizing telehealth appropriately.
Yeah, it's kind of like expediting us to finally actually move into the 21st century.
Right.
Well, it's a supply and demand thing, right? There's
Yeah.
demand right now, and so there's going to be companies that are really going to step up and provide that kind of platform to do these things, and they exist already, but I think you're going to see more popping up and probably much more refinement of these platforms that it makes it, you have to think about confidentiality and HIPAA and everything else. And, you need a lot of security built into these platforms so that you don't violate any of those things. So I think that's, you're going to see this happen, and it's going to get, there's going to be a stronger push.
Yeah.
Probably. And people, now that they were forced to do it, they're like, this isn't so bad. It's probably, maybe it could expand our market of patients we could view now, so if you're a top-notch surgeon in Philadelphia, wow, I could still see somebody in Texas, and they don't have to get on a plane and fly to see me. We could still do this, and maybe this is a new market for hospitals to, try to market to get patients from outside areas.
Yeah, you wonder if this can kind of help some of the systems that are sending athletic trainers to multiple high schools in different settings to give them another tool within their toolbox to reach out. And it also introduces the idea of potentially doing some research to test the evidence behind those outreach programs.
Absolutely. And Nikki, getting back to how online learning and online teaching can be effective. I mean, because I know with the new 2020 standards, that 8-week immersion, where they could be in a whole different state and still needing to do online assessments and, online classes. So we really do need to, this really did kind of help and force and bring us together to think about, okay, well, how are we going to teach these hands-on, very clinical skills and have these clinical, advanced clinical discussions remotely without, these patients and practicing and these hands-on techniques in front of us. And I think that is another line of research that is necessary anyway. And that this, thinking on the bright side, that this really is, forcing us to dig deep and, think outside the box much quicker than, we probably would have over the summer to get prepared for the 2020 standards.
Not to be the Debbie Downer, but with you guys having students that are doing research, how do you see this affecting students involved in sports medicine research and the influence it might have on their research careers?
I know I had a discussion with my graduate student today at our at Temple, the graduate program. They perform a master's project, and they do it within 2 years. And so really it only ends up lending them to have maybe 2 or 3 semesters worth of data collection, depending on, their the extent to which their IRB and their, clinical demands are. So, and I had to have a discussion, that we may not be able to perform your project. And we had to think about, ways of reforming the protocol without losing kind of the key take home, points that we wanted to try and make in the story that we wanted to tell. And, we're going to have to do some telehealth and working with technology, using some different apps and researching some different apps that we'll be able to collect from. But like you guys said earlier in the beginning of the conversation, without any athletes, without anybody performing their consistent practices, I don't know how well this will be able to translate into a full story anyway. because what we were looking for is like pre and post a season. And if there's not going to be a season, you know, what story are we going to tell? Are we going to just say, you know, pre and post one session of remote physical activity? You know, so right now, I have some students that are going to be able to do their research, and that we're reconforming. Instead of having in-person concussion education, we're going to do concussion education videos and deliver that, you know, via a link instead of in the lab. But then some others that we're looking at, you know, repetitive head impact and the possible effects pre and post a season. We have to rethink that. And you know, like I said, we're gonna look at different apps and reconfigure kind of what story we're gonna say, but it's difficult.
Jane, I think that's a great approach. You know, Westchester's similar in that we have theses or projects over the course of 2 years. So at this point in the semester, we have a lot of our projects trying to wrap up. And what was really interesting to me is when I met with my graduate student, and just the sheer, because of everything going on in the world, there was just this real lack of motivation and lack of belief that she was really going to be able to get it done. And she was really set up in a stage that was probably much better than her peers were. But I think what was important to think about is where her research project was really well done, just kind of the gravity of everything going on in the world, it became less of a priority for her. So it took some time just chatting with her and really kind of trying to remotivate her. And we just had a call this morning, and she's ready to defend, and she's done an outstanding job. But you know, so it was a little disheartening to see that, and it reminded me it's not all just about the research and the work. You had to step back and kind of treat people like people, and then like that she could power through and do it. And then on the flip side, we've got our year ones getting ready to propose, and they have all these fantastic ideas. You know, so to your point, we're proposing the story as if we're going to return to the old normal, like everything's going to be fine. But we are developing contingency plans and understanding what might be clinically meaningful, and whether it's, you know, conducting a systematic review of previous information versus kind of doing your own original research as possible opportunities, or doing needs assessments, you know, and gauging an idea of a knowledge and awareness, you know, so that we can figure out are the problems that we can solve once we kind of return to athletics life.
Yeah, I did similar approaches. So, you know, luckily our students graduating this year had all their data collected. One literally finished 3 subjects the day before we closed campus. So that was like perfect. But, you know, in the event that that didn't happen, we obviously would have, you know, allowed that to be enough data to kind of tell a story, and maybe it wasn't publishable, but maybe it would have been kind of preliminary data, and somebody else could take it on next year and kind of, you know, finish it up and collect more subjects. So there's always ways to kind of work around it, but, you know, from a publication standpoint, it wouldn't have probably got published in that form. Luckily that didn't happen, and we had enough power. But for our first years that are upcoming, yeah, it's basically, okay, we're going to propose this idea in the event that in the fall we're back and we're back to normal activity. But if that doesn't happen, then, you know, we have to have this kind of backup plan. And from my perspective, the type of data we collect, we can't do remotely. So it would, you know, our approach is really going to just do a systematic review. And the project was centered around that. So, yeah, I think that's our approach, and we may see more systematic reviews popping up just because of that, because it's something we don't, you know, you don't need to collect on subjects on. You don't have to. You could do it remotely. You don't need IRB, and it's not that it's less work. Systematic reviews are a lot of work, but yeah, it does. In the current state, it's probably the best opportunity to be successful in a project.
And Steve, you brought up generational research, you know, and for me, this pandemic is really going to slow down, I think, the ability for the students to be mentors to other students. And we might just lose a little bit of traction, because I think that's a really valuable experience for them to understand that they are the expert or a relative expert within the area. So I'm a little nervous about that. But, you know, I know that we'll bounce back and everything will be okay.
So related to that positive note, what message would you give to people that are starting to think about that are graduating with their PhDs or considering getting into sports medicine research? What recommendation or advice do you have for them?
I mean, I think one of the things that I would still say is, don't lose your research line. Don't, you don't have to take steps back research wise because of what's happening. But I would suggest, thinking outside the box and thinking about your research line and how you could utilize telehealth, or how could you utilize home exercise plans or preventative plans, things that they can do on their own at home, that can be tracked and logged remotely. Thinking about some of the things that they've been having to see or do remotely because of school, and some of the hurdles that they've had to overcome. Think about those hurdles and how you can turn that into, a research project.
Yeah, Jane, I think, oh, go ahead, Steve.
You go ahead.
No, go ahead.
Go ahead.
All right. So, sorry, Jane, I thought you had some really good advice there. And similarly, I just want to say that, I think that folks should continue to examine their passions. And oftentimes when things get difficult or uncomfortable, that's when some of the biggest difference makers and innovation can occur. So coming out with all that energy, I think there's a unique opportunity to make a big splash, and to not to be discouraged by what's going on.
Well said.
Yeah, and really just taking this time to, strategize and think about possibilities and problem solve, right? So, one thing you could, take this on and get stressed and say, oh, well, this is just, it's not going to work, and kind of give up on it. But, or you could take the other approach of saying, okay, this is just a problem. This is just a small roadblock. Let's find solutions for it and move forward. And that's what having a PhD or being a researcher is all about, right? We're trying to answer questions that there's no answers for, and it's always roadblocks and it's always problems. So, from a positive spin of it, this is a learning opportunity for them to try to kind of become good problem solvers and say, okay, yeah, we had this setback, but how do we work around it? And this is where creativity comes out. And like Nikki said, that innovation that normally wouldn't have kind of popped up or came into somebody's head because they were never pushed against that wall, so.
Yeah, I think that's a great point with the research. And I think, kind of staying true to our mission, our website's mission is, this is also a great opportunity from us to learn from the other fields and how they're handling this pandemic, and the lessons learned from data dissemination and how we can be better communicators. I think too often the sports medicine community, particularly in the research area, we tend to write our papers to other researchers and not always to our audience for the journals. And it can also open up opportunities to look at how some of the scientists right now are finding online social media platforms that are kind of unique to get the word out, to disseminate public health messaging. I think there's a lot to learn from the public health arena that, they've been doing it for years, but it's a good example to young investigators on how they can promote their research and really get the word out. We always focus on kind of a key take-home message on each of our article summaries. So I was wondering, granted, we're only in the beginning, hopefully half of the pandemic, but what would your take-home message be so far for listeners and clinicians, and that includes researchers as well?
I would say, really just utilize this time, in the best way possible. So, you can't be collecting data and you can't be, doing these kind of physical research steps, but it's a good time to reflect and think and kind of, expand your mind into the possibilities of what we could look at in the future, and, think of creative ways or study designs to kind of enhance the questions we want to look at and try to get answers to. Or make headway on, data that we had, or look at it a different way, or, these types of strategies that there's always something we could be doing. And, just try to think about those and start making headway right now when you have the opportunity to.
I think, one thing that I really see is, teamwork. And I think, Jeff, you mentioned it, really eloquently. Like, we need to be interdisciplinary, and I think we need to, utilize technology. And I think if we do what, Steve suggested, if we are creative, if we continue, our research lines and our passions in a creative way, utilizing an interdisciplinary approach and technology, we can come out of this even stronger.
Yeah, I mean, I agree with everything that's already been said. I think this is a good moment to pause and make sure that our priorities are kind of appropriate. And then from there to kind of adapt and overcome and figure out a way to balance the personal life, the craziness of society, in addition to our passions, to try to put forward the sports medicine community. And I think now more than ever, the interdisciplinary component is definitely emphasized, that we're all kind of striving for the same purpose. And I really hope that that energy kind of and momentum continues forward.
I think those are all great points. I think the other thing that I've kind of seen with the pandemic is, a lot of the treatment ideas and innovative approaches that are being used to treat patients right now are coming from the frontline clinicians who have an idea that's kind of might be out there, but it seems to make sense to their mind. And then, they start getting more and more data, and it seems to either at least inspire trials that may lead to the answer. And to a certain extent, athletic trainers are really creative in their treatment decisions and how they do things. And I know we have a lot of clinicians right now that are doing telehealth or might not be able to have hands-on time with their patients. And I wonder how many of them could think back to some of the patients they've treated over the last few months and about the innovative ways they've done it, and potentially offer a case study, like a brief report or something, to kind of show the rest of the world of, hey, this is the neat way I handled this person with chronic ankle instability, or this is the neat little trick that I found when I'm with this type of patient, because, it's working for you, but nobody else outside your facility might know that it's happening, and it could be the next big breakthrough for us.
Yeah, there's actually if it was on Netflix but kind of a show to use telemedicine to solve these very complicated, very rare diseases and conditions. So they kind of shared it through the website, or I think it was linked to the Post, the Washington Post or something. So this doctor would put out the case, and basically it was visible for the whole world to see, and then people would input, that sounds just like what I have. That sounds, but this, and then and I got diagnosed by this doctor in this country with this, and but it really led to some of these patients getting answers, where they were seeking their information in the United States or somewhere else, they weren't getting those answers. So maybe that could open up a door for us. Obviously, it's a smaller area, but we always have these cases that we're just scratching our heads at, and maybe you could create a platform like that for clinicians, where they could kind of, hey, here's the patient I have and I'm struggling. Anybody else seen this before? And they could help out. We have it a little bit on some social media mechanisms, but not to the broad sense of it. I think, could create opportunities like that.
Yeah. Does anybody else have any last thoughts before we wrap up for the day?
No, this was fun.
Thanks for having us.
We'll have to do it again soon. Thanks for coming on today to have this discussion. Hopefully we'll have this type of discussion again, but perhaps not about a pandemic. But thanks for taking the time today. Appreciate it.
Thanks, Jeff.
Thanks, Jeff.
Stay well.